This first case shows a little bridge. The posterior crown is loose, unfortunately for this patient, but it will take us something like 40 or 50 seconds to remove the anterior crown and to check what is happening underneath. Unfortunately for this patient, the posterior crown doesn't fit anymore, so we'll have to make a new bridge, but we were still able to reuse this bridge as a temporary immediately. As you can see, the prognosis for this tooth is really poor, and this explains why we are going to remove this crown in order to make the root canal treatment is in the best conditions. It took us something like 2 or 3 minutes to remove the crown without breaking the porcelain. We could have done also the window on the lingual side, but for the video it was of course easier on the buccal side. And as you can see, after the treatment we were able to reuse the crown immediately as a permanent. We didn't want to make a temporary or a new crown because of the poor prognosis. This other example is to show you that you can remove the crown by making the window on the lingual side, and I would say on the palatal side in this case. Usually on the upper teeth it's far easier on the palatal side, and as you can see, WAMkey is extremely powerful again, and we removed this crown very quickly, and that's it. Here is now another case. So that's a very easy case. Metal crown on a posterior tooth. We just removed this crown in less than a minute for sure, and then after the treatment we cemented the crown again. But I can't remember if it was permanent or temporary. Here is a bridge with metal and porcelain fused to metal crown, and this bridge is to show you that even when you have a lot of decay, which was the case here, we had some mush, we can still remove the bridge thanks to the fact that you have several sizes of keys, and this is the reason why we need the several sizes, small, medium and large. Usually you start with the small ones, and if the small one is too small, then you use the large ones. I'm sorry for the quality of the video, but this is a very old case, and this was a several unit bridge cemented on vital teeth. And again, all we have to do in such case is to break the seal successively on each abutment. So I would say that in such case it didn't take more than a couple of minutes, and of course we were able to reuse it as a provisional. And there it is.